students طلاب صف ثالث. Is there anybody here, please? Anyhow, I will start the lecture, which is entitled Introduction to Medical Mycology. In the beginning, I would like to introduce myself. I'm Prof. Dr. Azhar Abdel Fattah Al-Atraqchi, responsible the Chief of Bacteriology and Mycology. What is mycology? Mycology is a new science which is different completely from bacteria, okay? It's dealing with human fungal diseases. Please, anybody here? Anybody here? Anyhow, I will return to continue the lecture. I will give you some information about fungi. Of course, you hear about fungi somewhere, anywhere. Okay, what are fungi? Fungi are type of creatures which are micro. Some of them micro, which is different from bacteria, different from viruses or parasites. But it's also considered to be eukaryotic, look like animals or plants. It's not prokaryotic. Prokaryotic is bacteria, you know, but fungi are eukaryotes. But it is at the same time, it's not plants, different group or entity of microorganism which is different from plants, also different from animals. Here I will turn to the general characteristics of fungi. But just please, if there anybody here, just raise his hand to know. Nobody there, please, students. Anyhow, the general characteristics of fungi. Concerning these fungal cells, these cells are encased within a rigid cell wall. This rigid cell wall, which is different from this found in bacteria, this is composed of chitin and glucan. The animals lack this cell wall, but plants surrounded with cell wall, but it's the main constituents of the cell wall of plants are or is cellulose. This is first character. Number two, these microorganisms considered to be heterotrophic. They lack in chlorophyll and cannot make their own food, but they ended within the food source or the medium. Of course, they secrete enzymes, and in its role, these enzymes will digest the food and then absorb it. Number three, the fungi are simpler in structure than animals or plants and have no cell divisions into organs. That means it's not the system of the, as we know, we have a system. I mean, we are mammals, okay? The system divided into different organs. In fungi, there is no such entity. It have no cell divisions into organs or tissues, but it's formed of what is called hyphae. The main constituents or the structure of the fungi composed of what is called hyphae. Hyphae, it's mean high fat. I'm sure that you hear about the hyphae. These hyphae are either segmented or not segmented, which are tubular-like cells. Some types of fungi can change itself, which is mainly the pathogenic form. This pathogenic form mainly referred to as dimorphic fungi. Why? Because it have the ability to change itself. Outside the human body differ from the inside. Outside the human body, it's formed the hyphae, while when it's entered to the body of the mammals, for example, human, it's transformed to the yeasty form. From this, we can conclude that we have two types of fungi, hyphae form and yeasty form. Okay, but some fungi referred to as dimorphic because it have the ability to transform from hyphae to yeast. Okay, this is the meaning of dimorphic fungi. We shift to the other slide concerning mycelium. I want to define this is the first lecture. Lecture, it's just introduction. I just give you the main terms that you will be interested, that you should know. Then we in the second lecture, inshallah, and the third, we will know the or enter the clinical mycology. Just this is definitions, just to know the main informations about mycology. Here, what is mycelium? This is the term maybe you know or maybe hear in the future. What is the meaning of mycelium? Mycelium is a mass of branching hyphae. If you remember, I said previously hyphae, which is tubular-like, some fungi, tubular-like structure, some of them yeasty, some of them both forms. The collection or mass of branching hyphae of the vegetative stage of fungi referred to as mycelium, and some hyphae are septated, some that mean divided, some of them not divided. The acetate one, it's the primitive one because it's not advanced, while the advanced one mainly septated. That means tubular hyphae septated. If it is septated, that means the fungi is highly advanced one. While if it is aseptated, that means it is not, it's a primitive one, which is referred to as sinocytic. It means in Arabic مدمج. What is the molds? Molds, it's multicellular mycelium. That means we have two types of mycelium or hyphae, sorry, the vegetative hyphae and the reproductive hyphae. The vegetative hyphae, which is belong mycelium, but we when say molds, it's composed of vegetative and reproductive one. Okay, later on we'll know what is the reproductive one. What is the that's we here we I put the most important points concerning the hyphae. I turn to the other type of fungi, which is the yeasty form. Yeasts mean khamira in Arabic. This form of independent single cells, which is propagated by budding out of the mother cells. The bud may be still attached to the mother cell or maybe detached from, separated and go here and there and reproduce in the everywhere. Number four, I mean the fourth character, fungi. Fungi are produced by means of microscopic propagules, which is referred to as spores. Spores is the mainly sticky with hyphae. Hyphae forming spores. Spores is the mode of propagation of the fungi, while yeast by budding. Some fungi reproduce asexually, producing spores. That means if it is we have two types of reproduction. Sorry, reproduction sexually or asexually. Asexually by spores, but if it is reproduced sexually by meeting of two hyphae, either in the same mold or from different molds. If the meeting of hyphae from different molds, for example, A and B, this is referred to as heterothallic fungi. When it comes from meeting of two hyphae from the same fungi, this is referred to as homothallic fungi. Now, still nobody here? Please, if there is anybody, please raise his hand to know. Nobody here? Okay, I still continue the lecture. Okay, now medical importance of fungi. Here, this is very important part of the lecture. Why? Because fungi is medically important for our life. How? Starting from the beginning, from the most important one, the antibiotic. You know that antibiotic can be derived or extracted from fungi. How? In 1941, penicillin, which it's produced or found produced by fungi referred to as Penicillium chrysogenum. Put in your mind the names of fungi here differ from bacteria. Bacteria may be easier, but the names of fungi here, it's not easy, okay? Maybe complex, maybe more longer terms, okay? But starting with penicillium, which is very common fungi, Penicillium chrysogenum, which is the main important or most important source of penicillin. Everybody knows what is penicillin, which is very important antibiotic, which is discovered by the clinician Fleming in 1928 in the Second World War, or sorry, First World War. He accidentally discovered this microorganism, discovered the antibiotic by culturing when the soldiers exposed to trauma wounds. Of course, he tried to culture the causative agent. He found in the plate, on the plate, of course, he found the causative agent is Staph aureus, okay? After a period of time, he found that there is a colony just adjacent to S. aureus, but he didn't know what is or it belonged whom. This is, of course, put in your mind, penicillium is contaminant fungi, but in the same time, it's pathogenic for human. When he found that the colonies just near, I mean colonies of S. aureus, Staph aureus, just near penicillium cannot be grown. He interested with this, but he didn't know, of course, in the beginning what is the materials may be produced by this fungi. Later on, the two scientists, Fleury and Chain, in 1941, study on this, the Penicillium chrysogenum, and extract the very important antibiotic, which is referred to as penicillin. This is first. Number two, cephalosporin. You know, cephalosporin is very important antibiotic. Also can contain beta-lactam ring. And the original fungus found to produce this compound is referred to as cephalosporium. This is very important, nice. That's, we can see penicillin from penicillium, cephalosporin from cephalosporium fungi. Hence the name. The only, I'm here just speaking here about antibiotic. The only broadly useful antifungal agents from fungi, griseofulvin. This is another antibiotic, but this is antifungal, not antibacterial. The first two antibiotic, penicillin, cephalosporins, are antibiotic, while griseofulvin is antifungal agent. The original source of this antibiotic is the Penicillium griseofulvin. That is the name. Griseofulvin is fungistatic rather than fungicidal. That means it limits the growth of the fungi rather than kill it, but it's used for the treatment of dermatophytes. Dermatophytes, of course, here it is strange for your hearing. Later on, we will know what is dermatophytes. It's very important fungal disease. Another antibiotic, which is the sordarines. Sordarines is a structurally complex molecule that shows a remarkably narrow range of action against yeast and yeast-like fungi. Later on, we will know what is yeast-like fungi, but put in your mind that sordarine and griseofulvin, both of them are antifungal rather than antibacterial. I turn to the other importance of fungi. It is immune suppressant agent. How? You know, you hear cyclosporin A, which is very important immune suppressant agents produced by two types of fungi referred to as Trichoderma polysporum, Polysporum and Calendrocarpon lucidum. This cyclosporin A has proven to be a powerful immunosuppressant agent in mammals, which is used in any operation or big surgery, just look like bone after, of course, after bone marrow and organ transplant in human in order to prevent rejection. Gliotoxin is another immune suppressant agent which have immunological and antibiotic activity. It have two dual activity, immunological and antibiotic activity, and this is very important, produced by many fungi, concerning the most important one, Aspergillus fumigatus. Aspergillus, very important fungi and very found commonly. It is contaminant agent. Later on, also we will know this fungi, important fungi in our life. The other importance, the third importance of fungi is ergot alkaloids. What is ergot alkaloids? There is a fungi referred to as Claviceps paparia, which is a fungi produce ergot alkaloids. What is ergot alkaloids? Ergot is very important toxin, which is consists of important compounds referred to as alkaloid, which it act on the sympathetic nervous system, resulting in what? In contraction of blood vessels. Therefore, it's used to treatment of migraine, شقيقة, and postpartum hemorrhage. Pregnant women after delivery may be exposed to postpartum hemorrhage. Therefore, the patients should be undergo treatment with alkaloids of ergot in order to stop the hemorrhage, maybe lead to death if it is confused. This is very important in our life. I mean, fungi. Also, there is what is called statins. This is fourth importance. What is statins? There is a fungi, Aspergillus. I mentioned this previously when I spoke about the um, immune suppressant. I said Aspergillus fumigatus. Here there's another species, Aspergillus cereus, which is a soil-borne fungi, produces secondary metabolites. These metabolites refer to as lovastatins, and there is another species or another genus referred to as Phoma species, produce sequelastatin. What are these lovastatins, sequelastatins, which are the long-statin compounds? Statins have been used to reduce or remove low-density lipoproteins from blood vessels in humans. It's very important. And if you have in your family, maybe somebody use atorvastatin, if you hear about this compound, chemical compounds, this comes from, you should refresh your mind and say, oh, it comes from fungi, derived from fungi. You can see it's very important in our life. Put in your mind, of course, in addition to that, it is medically important. Why? Because it's pathogenic. Some of them can be edible. We can eat them, mushroom-like, okay, or truffle. Later on, we'll read the details. We'll know the details. What are the classification of fungi? Just I will mention the names: Chytridiomycetoma, Zygomycetoma, Ascomycetoma, and Basidiomycetoma. Chytridiomycota, Zygomycota, Ascomycota, and Basidiomycota. These four important classes of fungi. Now we turn to the lab diagnosis of fungal infections. The diagnosis here relies upon a combination of clinical observations and lab investigations. That means if we want to have a real and success results of diagnosis, there should be a good relationship between the clinician and lab investigator. Okay, if there is no good correlation, we have no good diagnosis. This is very important point of view because the clinician should orient the lab investigator, the site of infection, the samples what the sample he should select from, and the volume of the sample depends, whatever. But should be good relationship between these two parameters. Put in your mind the relationship between any disease, particularly germal infection or infectious agent. There is good relation, or the parameters of relation. It's look like triangle because it's have three arms related with patients on the apex, of course, clinician and lab investigation. Okay, this is very important relationship between these three parameters. Now, concerning lab diagnosis or method based on three broad approaches. How in the lab, what are the approaches used for the diagnosis of fungal infection? Of course, this is not for fungal, any infectious, but here, of course, because we're interested with fungal infection, microscopical detection of the causative agent. CA, put in your mind, CA, it means causative agent. microscopical detection of the positive agent, isolation and identification of the positive agents. Of course, we should isolate the positive agent by cultural method, and detection of a serological response. Of course, this is the other method for diagnosis. Of course, bases the methods based on the detection of the DNA of the fungi. This is based on the molecular method for detection, just like PCR or whatever. Now, direct microscopic examination of clinical specimens. In many cases, the definitive diagnosis of fungal infection can be made by the direct microscopical detection, of course. Many cases sometimes depend only on the diagnosis or on the microscopical, which is referred to as direct method for diagnosis. This is enough. This is enough, okay? But of course, here the direct microscopical examination depend on the site of infection, on the specimen provided for the detection. For example, we have skin scraping if the patient developed cutaneous fungal infection, by scraping of the skin, by scraping by clean slide, and by using we take these scales after scraping, put it on clean slide, and put 10 to 20% of KOH, warm one, which is dekeratinizing agent. You know, skin keratinized one. We want to dekeratinize the skin in order to see what is the causative agent invaded within the skin. We can use KOH. Then we can put a drop of lactophenol cotton blue for the diagnosis. Lactophenol cotton blue, it's a general stain, which is a positive gram stain in bacteria. The general stain used in mycological purposes are lactophenol cotton blue, which is for the diagnosis. Another stain is the chalcofluoride, which is used for the staining of the cell wall. Indian ink, it's also, which is Indian ink. This is referred to as negative stain because it's used for certain purposes, mainly for encapsulated fungi. Now, the other method for diagnosis is histopathological studies, which is referred to as also it's a type of direct microscopical diagnosis. This is very important one and reliable method for the diagnosis, and particularly for subcutaneous, not cutaneous. Cutaneous we mentioned previously for direct. Subcutaneous or systemic, even systemic mycosis, we can use histopathological diagnosis. Of course, we can use different stains for this purpose: hematoxylin, eosine stain, or methaneamine silver stain, periodic acid shift. Different stain can be used for this purpose. We can turn to the culture. You know, or you see, we diagnose or depend direct microscopical diagnosis, histopathological, and the other one, which is the confirmative test, the culture method, the indirect method. This is very important for diagnosis any genus and the species, which it's the culture, the fungi. Put in your mind, all those fungi are not fastidious. That means it's not delicate, not fastidious. We can use different methods for this purpose. The general media used for the diagnosis of fungi referred to as subroots agar. S here, you can see the S after subroad. S, it's an ownership S. It's mean in Arabic S التملك. That means this name of scientist, Subroads. He is the father of mycology, the first one who discovered the medium. Okay, Subroads agar. We have also many, other media, malt agar, sha'ir, are used also for the isolation of different fungi. Brain heart infusion agar also can be used for bacteria, for also we can use it for fungi, and particularly for fastidious fungi. Fastidious, as I mentioned, delicate one, cannot tolerate the ordinary or common conditions. Here can be used for the yeast of, for example, one of the fastidious fungi, which is maybe complex for you, the name Histoplasma capsulatum. Later on, we know what is Histoplasma capsulatum. This is very important fungal disease. or fungal, sorry, fungi that cause different diseases, particularly pulmonary diseases. Okay, there is another media referred to as chrome agar. Chrome from the mean, it's mean coloring. Okay, it's according to the species we have different colors, which is mainly used for Candida species. Candida, it is very common. It is the mother of fungi, the chief, the queen of fungi. Candida species, okay, which is the media is chromogenic. Okay, here we should put a special antibiotic in the culture. Why? To prevent the growth of undesirable pathogenic bacteria may be found in the specimen that we obtain. Antibacterial antibiotic in the media and the optimum growth of temperature, of growth here ranging between 28 up to 30. This is depend. Some of them need 37. This is depend. 28 to 30 for superficial. Some of them need 35, 37 for two to up to 4 weeks. Here, put in your mind, fungi need long period of time in comparison with bacteria, which is need just 24 hours, maybe maximum 72 hours, but here 2 up to 4 weeks. So long period of time. Predisposing factors in mycosis. This is very important also for us. What are the predisposing factors in mycosis? Among factors that operate either singly or cooperate with each other to exacerbate or produce symptoms in infected personnel, what are these? Starting with the trauma. Of course, trauma, anybody may be exposed to trauma, and this is maybe develop fungal infection. In particular, put in your mind the traumatic agent that the patient may be contact with may be contaminated and consist of the source of infection. Just for example, ophthalmic wound. Okay, patient exposed to ophthalmic, eye infection with thorn, for example, splinter, celaya in Arabic it's mean. If the patient maybe this thorn introduce or invade his eye and expose to infection, the patient, and this thorn contaminated with the source of infection, the fungi. This is maybe flare up the symptoms and causing fungal infection. Wounds also everywhere in the body. This is mainly occurred in immune competent, not certainly immune compromised, because you have two types of entities: immune competent, immune compromised. Immune competent, immune compromised, both of them exposed, but this is mainly occurred in immune competent. This is first. Number two, genetic makeup. That means we have X and Y individuals. Okay, X develop certain disease, and why both of them not exposed to any source of infection, but X develop, Y not develop. Why? Because he have the ability to develop disease. Maybe both of them exposed to the source of infection, but X develop the disease, Y not develop it. Why? Because the first one have the propensity genetically to develop disease, and the main diseases, fungal diseases, depending on the genetic makeup, are dermatophytosis. Three, low hygienic conditions. We know, of course, low hygienic conditions play an important role as a predisposing factor for many fungal diseases, such as Malassezia furfur. Malassezia furfur, one of the most important fungal diseases, comes from low hygienic conditions. Why? Because it is normal flora in the body, but those personal and particularly young male, because this agent prefer oily skin, and they not wash or clean their skin. This is maybe flared and causing the symptoms. Now we turn to the fourth factor, which is, predisposing diseases, such as serious debilitating hematological disorders, such as leukemia, aplastic anemia, leukopenia, Hodgkin's disease, cancer, TB, DM. This is a factor. These are predisposing factor for fungal diseases. For example, now coronavirus. Also, they found that coronavirus, it's predisposing factor for fungal diseases. My student now will study on this, MSc student on this fact. Number 5, local lesions. For example, any patient exposed to local lesion, for example, mucosa incidence to a vitaminosis, decrease or yes, decrease the level of the vitamins. Patient or individuals exposed to irradiation, patients have peptic ulcer, bronchiectasis. These are predisposing factor for the fungal diseases, of course. Now, number six, certain local environmental changes, such as, for example, those associated with the use of antibiotic, those using folic acid, nitrogen mustard. Nitrogen mustard is a type of drugs used in cancer patients, hormones. Of course, if it's used, these agents used for a long period of time, or other modern or therapeutic agents. Why this occurred? For example, individual use antibiotic for a long period of time. This antibiotic will act against whom? Not just on the pathogenic bacteria. No, it will be eradicate the normal flora. Then of course, we have some normal fungal agents in our body. When we kill or eradicate the normal beneficial bacteria, here will be flare whom the pathogenic or normally, which is opportunistic, I mean fungi, presence in the human body. This is hence it's considered to be very important factor. I mean certain local environmental changes which results in decreasing normal flora and flourishing of whom the opportunistic fungi in our body. These pictures, just pictures showing the different, this is colony of fungi, this is another colony. Here the colonies of fungi is nice in comparison with bacteria. This is another, you can see here, this is another one, okay, this is another colonies, depend, this is according from different, this is just drawing one, painting, okay, this is referred to as histoplasma. If you remember, I said histoplasma capsulatum, which is fastidious fungi, need brain heart infusion agar. This is referred to as cryptococcus neoformans fungi, very serious fungi. It's yeasty. You can see here this is budding here, how it's budding occurred. This is propagated by budding. This is daughter cell. This is mother cell. Okay. This is referred to as Sporothrix schenkii, another fungi. We'll later know what is Sporothrix schenkii. This is mushroom, you know. We have mushroom, as I mentioned previously. Mushroom is a type of fungi. It's edible. Some of them toxic, some of them edible. I mean, we can eat it. Okay, truffle, الكمأ أيضا, it's another type of fungi. We can also eat it. And this is another colony of fungi. And this is another penicillium, I think. Okay, this is another colonies. It's different colonies according to the, okay, type of fungi. This is another type, which is fusarium. This is responsible for ophthalmic trauma. After ophthalmic trauma causing ophthalmic diseases. I mean fungal infection. This is also ophthalmic fusarium causing. This is another fusarium. Also picture of fusarium. This is penicillium. You remember penicillium? It's producing penicillin. This is okay. This is also penicillin. Penicillium. Sorry. This is aspergillus. You remember aspergillus, very important, toxic, and produce antibiotic, as I mentioned previously. This is the last slide, and thank you very much, students.